Hi, everyone. Thank you so much for joining us. I have Deana here with me, and we're going to be speaking about fear-free in rehab. Deana, would you introduce yourself to us a little bit?
Yes, hi. I'm sorry to correct me. It's actually Dina. It's spelled like that,
Deana.
but it's Dina. Yeah, that's okay. I'm sorry. I should have said that.
I'm sorry.
Don't worry, that's okay.
And
Um,
your surname, just how do you pronounce your surname as well?
it's Capucci. It's spelled like
Capucci.
cappuccino without the N-O, but it's Capucci. So Dina Cappucci.
Deana Cappucci. It's nice to meet you, Deana. Thanks for joining us.
Yes, it's a pleasure to be here. Thanks for having me.
Okay. All right. So a little bit about, if you guys can hear us, can you just give me a thumbs up in the comments? And then I also know that you're here, and let us know where you are in the world, and where you're listening from. And if you have any affiliations with Fear Free, maybe you're certified, maybe you're thinking about getting certified, or you have some questions about how it works in practice, you guys can let us know. So please let us know a little bit about yourself and your journey into Fear Free rehab.
Sure. Well, I work in rehab as well. I actually obtained my VTS back in 2017, so I'm very familiar with the rehab world. And I started doing Fear Free probably about a couple of years ago, maybe around like 2018 or so. And it's funny because my journey to rehab was actually from my soul dog, who had a lot of orthopedic issues, and I just wanted to be able to give him this great life, and that was my journey into rehab. So ironically, after he passed away, I actually ended up with a very fearful dog and like a fearful reactive dog. And it was a very new experience for me because I was used to working with these animals in the hospital setting, but it wasn't something I had to take home, So I really had to put my rehab books aside for a little bit and basically became like a trainer overnight. And it really has changed me a lot. And just like the way that I just approach all animals, look at animals, and just made me realize too, like where I work is in a specialty hospital. So we have everything, like not only general medicine, but then a bunch of different specialties. And I really feel like I've become more of like an advocate for patients, like walking through the door. I'm really just changing the way that that I approach them, because it's amazing how I see more and more that patients do look like quite fearful, and just
Yeah.
the little things that we can do to change them and make their experiences better has really made a difference for me. So I really enjoy being a certified fear-free professional and just being able to be an advocate for the patients. So.
I love that. I think most of us came into the profession through an animal of our own, through our own pets. Yeah, so I have the same I have the same story, but it's pretty cool that you then had a fearful dog. So what was he like? What was his history and his story?
So we adopted him, and he was 5 months old. And it's funny, it wasn't one of those dogs you just weren't expecting to get. I just reached out to one of the humane societies that I used to do volunteer work for, and let her know that Jakey unfortunately passed away, and we're in the process of kind of looking. But if anything comes around, she's like, oh well, funny that you mentioned that, because we just happened to get a 5-month shepherd mix, which is what Jake was. He was a shepherd mix. I was like, oh great, I'm like, is this like? I just felt like I had to take a look at him, And he was just this cute, black, black and tan. He looked more like he's like a shepherd Rottie mix. So he's got more of the Rottie colors, but you can see he's got the shepherd. And, I had this like instant connection with him, and so did my husband. And they wouldn't let us take him home right away because he had just gotten there. So they had to, I guess, go through whatever like admin process. And then also they wanted to get him like neutered and stuff. But like we didn't see any sort of fearful issues with him while we were there. Like they let us to visit him a few times, and we played with him when he was there. And then when we brought him home, just random things, like he didn't like anything like overhead, like we took him to a pet supermarket. That was his first experience, and he would like bark at all the signs ahead. He would be a little nervous of people like approaching him, and I didn't really think much of it. So I was like, okay, like this is, I don't really know much of his previous past, so he's just not having good experiences. But then like one of the first experiences was a dog coming towards him, and just the way that the dog approached him, he was not happy about it. He had no problem showing his teeth and snapping. And I was like, oh boy, what did I just adopt? But, being a professional in this field, the last thing I want to do is, just return a dog. So I think I'm very fortunate. We say to him too, working in, in a specialty hospital. And, I actually, work with Dr. Rodasta, who's like, the renowned behaviorist here. So we have that team right in our hospital. So I was very fortunate to have a really great team like support me and get us through all these issues that he had. And that's what I mean, that I really had to put like my rehab aside for a second and then really just work on behavior. But all these things that I've learned, I was really able to take and adapt just to, with my own patients. And, it's funny from a fear-free perspective, and even just from rehab, like, it makes me think like, rehab professionals have basically been doing like fear-free techniques for a long time, right? I feel like a lot of stuff that before was considered fear-free, I'm like, we were kind of already doing this a little bit, it's like we're like the fun place, like when all the patients are nervous about coming into the hospital, we're like, don't worry, it's okay. You're going to get a massage and treats and all this great stuff. So we're going to make it pleasant for you. So I just think it's really like cool that these two subjects really go like hand in hand, the fear-free and rehab too.
Yeah, I agree with you. I think that that we have to have a really good, like we can't have fear in our patients when we're rehabilitating them, because it's not helpful for healing. It's not helpful to achieve our goals. I actually have a very similar story to you, and I keep looking at her. A similar story. She joined our lives about like 3 or 4 months ago, and she was a neighbor's dog, and they had to move where they couldn't take dogs. She's a big, beautiful Ridgeback, 8 months old. We went to go see her, and this boisterous and like gorgeous dog that was just super confident and amazing. And when we brought her back home to meet our dogs and see how she likes our like just our clan, really, she was a completely different dog, terrified of everything. She couldn't move. She was like really very terrified, and it was it was quite a challenge just to get her okay with the other dogs, with us, with the whole environment. And then we sent her back home, and we did it again, and we did it again until she was okay. But it was very interesting. And still, like, she has some things like I can't touch her bum. So those kinds of things. But she's she's a completely different dog now than she was. It's just patience.
A lot of patience for sure. I had to, I was joking around. I'm not a mother, but I felt like a mother absolutely with this dog, because here he is with 5 months old, and like just constantly doing training. I was like, by 8 p.m. I'm like, you are going to bed. I'm like, I am mentally exhausted from working with him, because it really, because it wasn't only all the outside things, like, a lot of stimulus on the outside, but also people too, and that was really hard for me, because, my soul dog can go with anybody. He loved all people, children, other dogs, like everything. So I never really had to worry about him. But for this dog, I unfortunately had to. So we had to, introduce him, or it's like we call it a secret handshake, So that's what the behaviorist had taught us to do. And I actually use that for my patients now, which I really think makes a big difference. And it's basically like this, so if we put him in a sit and just make him stay, and, we have him like look at the person and, let him know that this is somebody that you're going to meet, and we keep it at a distance, because that was one of the things that we recognized, that he doesn't really like when things are too close, he becomes nervous. So we have to give him some space. And we have this thing where we do a touch and then a treat. So the touch is he's going to touch the hand, and he'll get a treat in the other. And this is like an introduction, so it's like, if we're introducing you to this new person, we're going to allow you touch and treat. And it kind of like alleviates that anxiety. And then he knows that, like, okay, this is somebody that I'm going to meet. This is not somebody that I should be nervous about. And we still kind of don't let people pet him right away. We let him, let them give him his space. And then when he's ready, he'll come to them. So that, we just, we've learned a lot to just be able to respect his time, his behavior, and then, and let him come to us when he's ready. And that's really honestly made a big difference. And even in the veterinary field, when we bring him into for his exams and stuff like that, we're always giving him a little bit of a pre-sedation before he comes in. So this way it just kind of lowers that threshold a little bit. And he's actually done great. He really has. So it's definitely, it's taken a lot of work, but we're really happy with where he's been. Where he's coming.
That's amazing. I love that secret handshake. I think that's a very good technique, and that's that's easy to explain to people, like new people. We're going to let you do a secret handshake with our dog, and they think that's cool and interesting, right? I actually haven't heard of that secret handshake before, but I really like that.
Yeah.
And our patients would like that as well.
Yeah. Yeah, it really does introduce them to, so, you know, like when I'm bringing them into, especially, you know, if you think about it, like, especially a fearful dog, like a rehab room can be a little terrifying in a way, right? I mean, it's fun for us, you know, like there are some dogs that are like, oh, what's this? I know what this is, you know, like, and they'll just go right on the equipment, no problem. But other dogs, you know, like, I mean, think of like a laser coming towards you. It's like this big machine. It makes noise. There's, you know, like, then you have to put goggles on me. It's like, what is this, you know? So I usually, whatever, like I kind of almost use like the touch for everything, you know? So it's like, oh, look at that touch. Okay, here's a treat. Touch, here's a treat. And even just letting them just get familiar with the room, smelling the room, you know, if they look like they're concerned about something, I'll just throw a treat by it, you know, just really make it just a overall positive experience. When they're nervous about coming to me, you know, and my hands, because that's really what a lot of fearful dogs are nervous about, right? Like we don't really, you know their past histories, but a lot of them, if you notice, are very head shy. No dog likes when you go over their head, you know, so keep your hands down low, you know, and if they come towards it, you know, even if they just smell your hands, okay, there you go. There's a little, you know, treat, you know, for smelling my hand. And then you can just introduce like the touch and then treat and then touch and then treat. And it really does build this trust, you know, like, okay, you know, maybe, you know, like I'm not nervous about your hands either because your hands are going to give you a treat, you know.
A really positive association.
Yeah.
So what's the biggest change that you've made in your practice since adopting fear-free strategies?
I mean, I would say probably just the way that we approach animals as a whole, you know, and not only from a rehab perspective, but like I said, you know, because we have a specialty practice and we're actually in the process of trying to become like fully fear-free, like through the entire hospital, which I think has really made a big difference. So, you know, one of the things that we say in fear-free is that fear-free starts at home. So one of the first things that we do and what our clients, our receptionists are doing when we're making appointments is already asking, you know, those questions, like when, you know, when they're making appointment, like, you know, is your dog fearful? Your cat also, you know, let's not forget about our cats too. And you know, and really just making those changes while they're at home so that this way we can pre-plan before they get into the hospital. And so we do the same for our patients also, you know, so if when we're making appointments, making sure, let's find out what kind of, you know, fear and anxiety they have at home so that this way we know that when they come into our building, we're already prepared for that and making, you know, giving them a better experience. And then also like, just the way that we approach them, you know, like I like to joke around and say a lot of people call me a lab because I'm like that, you know, smiley, goofy girl that's always like, what are you doing? I'm like that person, you know, that I come to that person, like, you know, like that, like, hey, how you doing? I haven't seen you in so long, you know, want to give them a hug. And like, sometimes I do that with dogs, but not realizing that every dog wants that, right? Some dogs are like, whoa, slow down, your energy is a little too much, right? So I've really made a difference in approaching them too. You know, if anything, actually, I probably make more eye contact with the owner now and don't really look at the dog until the dog comes to me. And I think that makes a big difference also, you know, because so whether they're fearful or not, you know, it's not like, you know, I'm not like this threatening person walking towards them. So I think that's made a difference. And even just as far as our, you know, restraints and stuff too, I think again, you know, I feel like that we've already been practicing fear-free before it was called fear-free, but even just like gentle restraints and stuff too, in the fear-free world, we call it gentle control, less restraint, sorry. Less is always more. And we've been doing that for a long time too. But this movement really just, I think, really puts it in people's head not to, that we don't need to restrain the way that we used to, you know?
So going from doing rehabilitation and then getting fear-free certified, so I know we've already said that there are a lot of things that we're already doing, but are there things that you've completely changed? So we do, you know, restrain gently, but perhaps there are things that we normally do that you've completely changed and you've said, I'm not going to do it that way anymore, and I'm going to do it this way. I don't know.
Yeah, I think it would be more with that restraint, you know, I mean, because we recognize now too that it's not worth stressing out a dog. Like if an animal's coming in and we can't get, like, they're so nervous. And I think the main thing would also be is introducing those, what we call PVPs or pre-visit pharmaceuticals. We didn't always do that for a period of time, but now, like, it's becoming more of like, okay, this is what we're going to do. If we know a fearful dog is coming in, we are absolutely going to make sure that this dog has pre-visit medications. And so this way that we can do a more thorough exam and make it pleasant for them. And actually, we just had a patient yesterday. What a difference from like her first initial consult. She went to our surgery department, and then the surgery actually recommended, giving her preemptive gabapentin and trazodone. So I'm looking at the record, and like, on her emotional record, like on an exam, it's a 5, and that's like, do not approach this animal, basically. Like, that means that she's extremely fearful. We need to abort mission, So, and I love the fact that we're introducing the emotional medical records and stuff too, because it really tells you what's going on with that patient, like how, like, from the minute they enter the hospital to the exam, to the, even like in their kennel. So we know from a whole perspective, how are they going to respond to certain things that we do. So she was given, the owner was very compliant, and she gave her the medications as directed a couple hours before her appointment. And this dog, I was expecting to see a dog like shaking, and extremely nervous. And she actually wasn't at all. She was sitting in the mom's lap. She looked a little high, but it was good. Like, she was great. She walked back with me. We did a nice, like, gentle exam, and she was wonderful. And I love cases like that, because it just shows, like, okay, if we really introduce and make a really, really, like, keep these, be consistent, like, with this practice, then this is going to change the way the whole veterinary profession does medicine. And I really, really love that. Yeah.
Do you need to keep giving them those meds if you have a very fearful dog? And you give them the meds ahead of time? Do you only need to do that for like the first 2 or 3 appointments, or do you need to keep doing that?
So I think for the most part, we usually have the owners continue to do it. But what's amazing is that you really do see a difference in the patient with each visit. And that's another thing that I love. And that's what I said too, how rehab has always been just a positive experience. Actually, in our hospital, because we have a general practice, within our building, we try to tell, our clients too, that, like, we don't want to be the bad guys. We try not to do nail trims. We try not to do anal glands, all those things that the dogs don't really like, unless they're really good for their nails trims, then we'll do that. But, again, we try to just keep it a really positive experience, because if you think about it, like, a lot of these patients, if they're coming to rehab, they've kind of already been somewhere else, right? Like, either whether it was surgery, and they had to go back and forth to surgery. So they've kind of been poked or prodded, or whatever kind of experience they've had in surgery. Or maybe they've been coming to general practice for a long time. Now they're older and geriatric, and they just have, they just need more mobility issues. So I feel like that usually when they come to rehab, they've already been through multiple departments before. So we definitely want to make sure that this is going to be a good experience. When they walk through that door, they are wagging their tail and they are pulling their owners, like, to our room. And that usually happens. And that's very rewarding for us, for sure.
Yeah. Okay. You need to tell me more about the emotional medical records, because this is the first I'm hearing about that. How does that work?
So I want to say, I think it's the within the level 2 or level 3 fear-free professional certificate. And actually, I think if you're also doing, our hospital is trying to get certified. So it basically gives you, there's like a scale of like from 1 to 5, I would say, right? So for the fear-free levels, and it gives you a list of different things, like, so from like the waiting room, I like on what level is the dog like feeling, like how fearful is this dog, like just in the waiting room, then from the exam room, then from the exam, and then in a boarding facility. And then it also lets you know, like, what things does this patient like, like, so if it was less restraint was better, does it like this, is it better with this person? So we write like people, because we try to be consistent, if there's a therapist or somebody that just had a better interaction, or maybe it was the first interaction and they're comfortable with this therapist. So we just try to keep that consistent. What kind of toys or treats or things like that they like. So it really just gives us an idea of just basically how this patient responded to everything that we did, and what worked and what didn't work, so that each time this patient comes into the building, we can refer to that and be like, oh, okay, like he liked working with this patient, with this therapist, and he actually really liked cheese, and make sure we don't cross the butt, right? Like something like that. And good for home until you touch the ankle, so because sometimes I think people just forget to put that in their record, like that, or just be like, caution, will bite. Okay, but why is it gonna bite? What did we do? Like not every dog I feel like is just gonna bite. I feel like that some dogs really just try to, even my guy, he is labeled as a will bite dog. But there's, he gets to a certain level before he gets there. Like this dog really gives us a warning. And if we don't follow those warnings before, then, we're going to escalate that. We're definitely going to escalate that scale. That's for sure.
I like that. So it's not like it's not something we haven't been doing, but because definitely, we do make record of if this dog needs to have a specific therapist, then that's put in the record, but most of it is actually just communicated with each other. So we'll have a chat if there's a concern after a consultation and say, there's some fear there, we need to watch this or that or whatever aspect, but we're just having a conversation. We're not really putting it down as a record. So I really like that. It's more clear, it's more objective, it's it's safer for the dog, right? Safer for all of us, because what if you don't get to have that conversation?
Yeah, right. And the other thing is, again, I think it really is like a written document or communication, or also from one department to the next. Because again, because of our hospital is very large, so we have a lot of employees, so having that, and again, this patient just came from a surgery department to our rehab department, so being able to read that record and see how she like how this patient responded, then we were able to approach her, or just knew how to approach her coming forward, and it was a really good experience for her.
Okay, I like that. So I want to talk a little bit about the relationship between fear and pain. Can you chat to me a bit about that?
Well, it's a very good topic, actually. And one of the things that we like to say is fear-free equals pain-free, right? Or pain-free would be fear-free. So we just know, just from not only experience, studies, people, that pain can definitely elicit a lot of anxiety, fear, and stress in animals. So I think that's where we are huge advocates in the fear-free, or in the rehab world, I can say, because one of the main things that we want to do is address pain, right? And that's one of the things that I like to teach whenever we have students and stuff come in as well. Is that a lot of people, I think, when they hear physical rehab, they think that we're going to do a lot of physical work, right? But it's not only physical work that we're doing, right? I think one of the very first things that we actually address is pain, because we know that if an animal is in pain, then that's going to decrease healing, and we're probably going to have a longer recovery as well. But we absolutely know that pain can absolutely induce fear, stress, and anxiety in our patients. So we definitely try to address pain as much as possible. I feel like it's kind of like a given. And actually, if you're interested, there's and that's why I love how much the fear-free just movement has expanded so much, and they have some really great modalities, or just extra. I think if you're a member with them, you definitely get free CE, and they have a lot of modalities on fear-free and pain management, and just approaching pain management in different ways, from chronic pain, acute pain, in emergency medicine. It's really great how much they've really incorporated fear-free in so many aspects of veterinary medicine.
So I think that relationship goes the other way as well, right? So when there's high levels of stress, then pain is also worse. So if there's fear, then so not only when there's pain, then that means fear is more likely or more present, but also the other way, when there's fear, it's more likely that pain would be worse or would be present.
Absolutely.
And really not a great effect on healing as well, right? Like when our bodies are in a stressed state, then they can't heal properly. So not helpful to our goals.
Right, absolutely. And one of the other things that, we try to do, again, from a rehab perspective, is, we're all about like mobility, right? Improving mobility.
Yeah.
And one of the things that I also have like noticed, is, dogs that have issues with mobility or pain, just on their surfaces that they're walking on. So just being able to change, that for them and just making a difference, like, putting down some yoga mats, or, we use this paw friction. So do you guys use that over there? Have you heard about that? It's like this glue that you put on the bottom of their pads. It looks like sand, but it's grounded down rubber. Yeah, you guys use that? Yeah. I mean, it's been very helpful for our patients. It can wear off a little, fast, but it works. And I just think that makes such a big difference, because now you have a dog that's, just say if it's an older arthritic dog that is already has mobility issues, definitely experiencing some pain and can't walk on certain surfaces, that's definitely going to create some anxiety, and also maybe some fear of walking on a surface that he doesn't feel comfortable with. So even just doing a little step like that makes such a big difference. And okay, now this dog can walk, feel more confident, less stressed, about walking on these surfaces, and then hopefully not be fearful that it's going to cause him pain, because we know that if he slips on, on the floor, that's definitely going to cause him, discomfort. So
yeah, it's not a relationship that we can separate at all. We can't deal with one without dealing with the other. They're just too interlinked. And I'm very much a horse person, and that's like really relevant to me as well. Is horses hide their stress very well, and that's when they also hide their pain, and they're usually coming from each other. They're in pain, they're stressed because they're in pain, or they become painful because they're stressed, because they adopt bad postures and then do bad things and then hurt themselves. Yeah. So I know, like, most often the biggest hurdle that we have when we're dealing with a patient that needs some extra help is the owner, right? Because they don't necessarily understand what's going on, or they have plans and goals that they want to achieve, and the dog needs to fit in with that. So how do you help your owners to get on board with reducing fear, and how do you help them deal with that situation?
I think it's just all about just, client communication and education, so like, I loved, talking and teaching to teaching clients. So if we recognize that their dog is a little fearful, I mean, you're right. It is kind of true. Sometimes they don't think about that, because they always say, but she's only like this here. Okay, well, if I understand that, but if she's only like this here, this is what we can do to make her, feel a little bit more comfortable, so that she has a good experience. One of them, being the medications, the preemptive medications, if we need to sedate them a little bit. And it's funny, because a lot of owners will sit there and say that, like, they either it doesn't work at home, or if it does work, they're like knocked out, so they don't want to give them anything. But I don't think they understand the concept that even though they're when they're at home, they're relaxed. Right? Everything's okay. Everything's predictable. They know what's happening. But if they're stressed going in, whether it's going to the car or going to a hospital visit, the anxiety is already there, So if you give them something just to take the edge off a little bit, they're not going to be passed out in our office. If anything, it's going to take the edge off. They'll still be maybe a little bit nervous, but it takes the edge off a little bit, so it allows them to work with us. I also like to tell owners they bring us something like high value, because sometimes our treats are not enough. Sometimes cheese and peanut butter is not enough, believe it or not. So I'll tell them, I'm like, bring a steak, a salmon, chicken, whatever it is that really makes them, just gets their motivation, their high value treat. So that's a good way to get them to, cooperate also. But yeah, I just really just feel like obviously just educating them, and just saying this is how we could work together, to just get the best results for your pet.
Yeah, I love that. I don't know if you've watched any of Robbie Porter's webinars, but he's just like, chicken is a part of his daily routine. So they buy chicken, then strip it, and all of those are the treats that they use. High value chicken, done.
Yeah. Right. Unfortunately, though, in our practice, we just have a lot of dogs with food allergies, which is so unfortunate. So that's why for the owner, if they have something that is high value to them, then, if they can't have chicken. So we actually use a lot of the hydrolyzed protein treats, believe it or not. I think just because there's like fish oils on it. So I think that they really like that. And because it's hydrolyzed, even if they're allergic to chicken, they're allowed to have those treats. And for the most part, they like them. But if it's a dog that's that nervous, sometimes they don't even want food. But that's why I tell the owner preemptively, bring something in for us, that is really going to get this dog's attention.
So, guys, if you guys are listening and you have a question, pop it in the comments. And if you have a case that you want to share with us, a patient that's challenging you, share that as well, and we can try and help and answer that. So, yeah, pop your questions in the comments if you have anything. And otherwise, so aggression, right?
Mm-hmm.
Fear, aggression is most of the time coming from fear, not
Mm-hmm.
always. But do you just use the same strategies to deal with that? Or what do you do differently? How do you handle a dog that is very likely to bite you?
So I would say one thing that we really introduced is actually, instead of using a muzzle, is using an e-collar. And I think that that's actually quite a safer way for everybody. Because for whatever reason, even though dogs can be a little head shy, but sometimes they can tolerate putting an e-collar over the head. And even if it's a ginormous e-collar, that's okay, right? Because the funny thing is, it makes me feel very safe, because no matter what, this dog can turn around, he can whack me with the e-collar, which is fine, but I know he's not going to bite me. And if anything, like, and even, if you think about it too, the e-collar has like a distance like from it too. So it's the distance from the nose. So even if I'm approaching the dog, like, over the top, which I normally don't, but even if I'm trying to just get like a leash or something around him, touching his body, like, I feel safe knowing that he can't even hurt me at all, because I have this distance, basically a foot distance from his nose, from his muzzle. So if that's one technique that, that we've really adapted a lot from with Fear Free, is really reducing the muzzle. I am a firm believer, and and this is something that I wish that like all veterinarians would educate their clients. I think that all pets should actually be muzzle trained as a pet. I mean, as a puppy, and I did that with Kyle, right away, just because obviously we knew that he had a potential to bite. But if you do muzzle training with your dog, you just never know, and also because of that too, right? Like, pain can really exaggerate fear. So like. And I'll tell you, my soul dog, I call him my soul dog because he is my soul dog. But, Jakey unfortunately got hit by a car, and he was the nicest dog ever. But because he got hit by a car and he was in such pain, he went to bite my husband when he went to, and he would never bite, But because he was stressed, painful, obviously just really just more like, stress and pain more than anything. And he didn't mean it, but that could happen, So, I feel like that it's really just important for owners to, if they introduce the muzzle as just like a daily routine, if like when they're puppies, positive for them. So then when that muzzle has to go on, they're not freaking out. Because a lot of these dogs, especially the aggressive dogs, it's like they know what that muzzle is and they hate it, And I wish that we could change that. I really do. Like an aggressive dog needs a muzzle, unfortunately, for everybody's safety. But why does it have to be why does it have to be such a terrible experience for them? But if you make it a positive experience for them, then we can change that. Maybe they won't be as aggressive, because I feel like that they're already fighting with you because you're trying to get the muzzle on, So we really kind of stepped away from that. And if we're able to get the e-collar on, I mean, don't get me wrong, there are some dogs that are just way beyond, stuff. And sometimes, unfortunately, you don't know. And that's where I think that, where the Fear Free starts at home makes a big difference, because if somebody's making an appointment and we know that this dog is aggressive, then, okay, what can we do prior to this dog coming in to make this less stressful as possible for everybody? Because even us as nurses and stuff, we don't like that. It doesn't make us feel good. We don't want to wrestle, pets. And honestly, since I've been in rehab, I haven't had to wrestle any animals, but, we're talking about back in the day. Like, that's what I mean, how this whole fear-free movement has really made a difference, I think, in just the whole way veterinary medicine practices. Because even in our emergency and ICU, I mean, they've changed so much, which I think is just amazing, for everybody. But I think the main thing with aggression is obviously having those PVPs, or, your pre-visit pharmaceuticals, maybe trying to introduce an e-collar instead. And unfortunately, I think there's only so much that you can do, like if I think and it's a huge responsibility on that owner. I think to really be able to kind of almost like condition the dog, to like getting treatments and things like that, like for Kyle, again, I introduced him to the muzzle so that he was used to the muzzle. So, and I didn't only do it in a way where it was going to be like, okay, you're only getting a muzzle when you're, when you're at the visit at the hospital. We do it at home and stuff too, so that he just associates it with like, oh, okay, this is cheese. So now I can hold it in front of him and say muzzle, and he puts his nose in it. because he gets cheese, you know, thank you, you know, so it's a positive experience for him. But I think that if more owners were educated to do that type of work at home, then maybe we wouldn't see these really aggressive dogs coming into the building as much.
I think that's a very good point. There's definitely, like, just from our side, a negative association or a stigma around using muzzles, and so we don't want to, and we don't do that, but we should, right? As you say, any dog is able to bite. It just needs the right combination of circumstances for it to happen, and you never know when that's gonna, you know, when that's going to be the case. So better to just be prepared. Right. I have started muzzle training my dogs now recently, and they're all, you know, they're older, but I need to do it because my shepherd decided to start hunting our goats.
Oh boy. Oh no. So he has to use it when he goes outside then too, huh?
Yeah, when we go for walks.
Okay.
So, yeah, but it's been an interesting experience, and it's definitely, yeah, I mean, it's not when you walk down the streets and you see a dog wearing a muzzle, you're like, oh my goodness.
Yeah.
It shouldn't be like that. Yeah.
Yeah. Yeah, and we talked about that also, actually, and there was a really great article. I'm not sure, it might have been in one of the veterinary practice magazines, but I thought it was a really great article that was just saying how, you know, just because you see a dog with a muzzle, don't just assume that it's aggressive, right? Because sometimes dogs, and, you know, we forget about that sometimes dogs eat things on the street. So maybe he's wearing a muzzle because he eats things, and then he's had a bunch of foreign bodies, and the owner doesn't want another foreign body, you know? And you don't think about things like that, you know? So I think people forget. They just automatically see, especially if it's a shepherd with a muzzle. Unfortunately, there's a lot of breed discrimination. I get it all the time with this guy. But whatever. All we can do is.
I have to say, I don't really mind that if I'm out walking and people give me a wild berth. I'm really okay with that.
Yeah, that's true. Be like, yeah, you don't want to come near this.
No, don't touch. Yeah. No, I've definitely ridden on the reputation that the breed has quite often. But my Sashi is like, yeah, I don't think he has an aggressive bone in his body.
Yeah.
You know, not even a protective bone in his body. I think he fell off the breed bandwagon just a little bit.
Well, that's good.
Yeah, that's completely okay with me as well. All right, I don't see any questions, guys, and I've really enjoyed that chat. I think that's continuing, like, even though we are always aware, and we are always working towards more, you know, more positive ways of handling and working with our patients, it's always good to keep coming back to this conversation and to keep saying, could we be doing things better? Could we be doing things differently? How can we adjust? Just the way that we approach our patients. My biggest light bulb moment in this regard was when I was doing a T-Touch clinic. And it was the first time that I'd really seen what choice looks like, right? And giving our patients choice is one of the biggest things that's going to help them feel safe and feel comfortable with us. So, and it's, I mean, not like I was forcing them to do things in the past. There was just no open channel of communication where I was saying, do you want me to do this? No, you don't like that? I'm going to stop doing it and do something else. You know, it was like, this is going to be really great for you. Trust me. Try it. Let's give it a go. Oh, you don't like that? Well, maybe I'll do it a little bit differently, but you're going to do this anyway, you know? So, giving them a choice and allowing them to tell us what they don't want. That's the biggest thing for me. Yeah.
What I've also done, and that's why I had said originally when we had first talked that I would love to be able to, like, you know, do a webinar more like with like an interactive, more like videos and things like that. So, and now, because when I have these fear-free patients come in, like I actually like recording them from like start to finish, like of how, like, okay, how we introduce them to, you know, the laser, or how they got over this, or like going over equipment like ramps and things like that, or just changing the environment a little bit so that they're comfortable, right? You know, like we have a couple dogs, if they want to run to the door, like, okay, well, you know, we're going to put peanut butter on the door then, you know, or put your wobble board or, you know, physio ball in front of the door there. And it's just, it really is so funny. And you know, like you talk about a choice, you know, so it's like, okay, their choice is they go that way, so I'm going to work around my patient, you know? But I think that also it's important because I think it develops trust, you know. So like if I'm forcing a dog to lay down because I want to give it a massage, but the dog doesn't want the massage, then what relationship am I building with this dog other than he's like, no, you're not listening to me, you know? But if I go to the corner of the room because that's where he wants to stand, and maybe I do a little bit of like, you know, massage or just some touch and standing, and he's like, oh, okay, wait, that's not that bad, and walks to the bed himself, then it's like, okay, well then we just communicated well, and then I was just able to get you to trust me that I'm here to help you, you know? And I really do love that. I've always loved animal behavior, and I really feel that there's such a there's such a strong relationship for what we do in rehab. And you know, when I was talking to one of my colleagues, and they had said too that she finds that actually her dog trainer friends, you know, or the clients are probably like the best clients for rehab, because like everything that we're doing in rehab basically is based on behavior. Like we are asking these dogs to do things that they're not used to doing, you know? So it's true. So like we definitely need patience. We definitely need trust, you know, in order to get them to do like what we want. So it's a really rewarding field, and I love being a part of it. I'm so passionate about it, as you can tell. So that's why I was really excited to be here with you guys. And also I just love hearing what other people do too. And you guys are across the world, so I'm like, what is going over there, you know, and how you guys do. So tell me a little bit about what you guys do too.
Oh yeah, so we've just had the Vet Rehab Summit. If you guys know that, I don't think, hopefully it's not possible that you don't know about that. But that's our annual conference. It's all online. It was amazing. We tackled some big topics. We had a discussion room about unity, and we're forming not us, the IAVRPT, we facilitated them to do that. They're forming a working group to help kind of bring some essentially unity into our profession. But that means there needs to be regulation.
Right.
It needs to be promulgated in different countries. It needs to be standardized and controlled, because otherwise we're all just forever going to keep coming from different places and not be able to mesh and unite and be one profession. So that was really exciting. And then a research discussion room as well, which is like my kind of thing. I love research. Which we're also going to try and just make, we're going to try and make clinical research a little bit more available, a little bit more viable, like so that you could start doing clinical research in your practice, or be a part of a larger study where you're sharing data and putting all our hats into one, all our cards in one hat, I don't know, but so that we could get to a bigger, better conclusion. But essentially what we do on a day-to-day basis is we are in continuing education, and we provide webinars and blogs and podcasts and Facebook Lives and any teaching that we can, and not coming from ourselves, again, facilitating other people to be able to do that. So we have lecturers from all around the world that work with us and that teach our members. And so that's our goal, to never stop learning and to help all the vet rehabbers out there to just never stop learning.
Great. I know. I love what you guys are doing. It's amazing. That's the reason why I wanted to actually, you know, be a part of you guys too, because this is exactly what we are doing. Like, you know, like you guys are the forefronts of all this, like specific to rehab education. And I love that. So that's great.
Thank you. All right, guys. Have a wonderful day. Thank you so much for joining me today.
Thank you for having me. It was great.
Okay. Bye, everyone.
Bye.